Are you ready to transform your summer into an epic splash-tastic adventure? Say goodbye to wasteful, single-use water balloons and hello to the ultimate in reusable, eco-friendly fun with reusable water balloons. Check out the link in the video description to get yours on Amazon today.
The number of children admitted to hospital with respiratory syncytial virus, RSV, and the flu has spiked in Australia in one of the worst ever outbreaks of both illnesses. Parents are being urged to vaccinate their children against the highly contagious viruses as cases skyrocket nationwide, with 117,650 people being infected with RSV this year. The majority of cases were in NSW, then Queensland, followed by Victoria and South Australia, 7 News reported. Influenza cases are also climbing, although the flu season is not expected to peak until mid-August, with Queensland experiencing the most outbreaks. Queensland Chief Health Officer Dr. John Gerrard warned that flu cases would jump once children in the Sunshine State return to school this week. During the school holidays, about 20 kids were being admitted to hospital with the flu each day, but Mr. Gerrard warned this could increase to 50 over the coming weeks. Dr. Gerrard is urging everyone eligible to get vaccinated in order to curb the knock-on effect of the virus that can spread quickly throughout a home and onto older and more vulnerable relatives, the Courier Mail reported. There were 24,256 cases of influenza in Queensland from January to the end of June, with 10% admitted to hospital. Although influenza has the highest infection rate in Queensland, cases for RSV has doubled from the same time last year, and most patients hospitalized are under 2 years of age. In NSW, the flu has had high numbers in children under the age of 16, but the numbers of infection climbed across all age groups in June. But cases for RSV in NSW has slowed down, after experiencing its peak in April. But in South Australia, children were succumbing to both viruses at a high rate. Children under the age of 5 were about half of the state's 125 patients who were in hospital with RSV or the flu. Deanne Tingey's 7-week-old daughter Winter got RSV around a fortnight ago. Ms. Tingey said her baby's symptoms had escalated and she needed hospitalization. In the morning she was just sneezing a little bit and she sounded a little bit congested, she said. Then she had gone completely off all of her feeds, and she'd had no wet nappies for the whole day, Ms. Tingey said. The mother said hospital staff put Winter on oxygen as soon as she arrived at the hospital, as well as a nasal gastric tube. Ms. Tingey is urging all parents not to send their sick children to childcare to help stop the spread of RSV. South Australia Public Health Officer Professor Nicola Spurrier said flu numbers in the state were probably going to be higher compared to the previous 2 years and were skyrocketing. It is not too late to think about prevention. It is not too late to get a flu vaccine, she said. Professor Spurrier said cases had also increased for whooping cough and mycoplasma pneumonia, but COVID cases were going down. Despite South Australia's rising flu cases, only 22% of children from ages 6 months to 2 years have had the flu vaccine, and only 65% of people aged over 65 are immunized. Professor Spurrier said currently only a RSV passive immunization is offered to babies who are born prematurely or children with existing health conditions. The professor said an RSV vaccine should be available to South Australian women next year who are pregnant, and it is expected more children will also be able to get immunized against RSV in 2025.